Million people in the United States suffer from arthritis. This Saturday, thousands will gather in NYC to try to raise money for this important cause. Physical therapist Karena Wu is on the committee for the Walk to Cure Arthritis. She joins us now to tell us more about really seems to be an epidemic now, right? 52 million people is a big number. Why so many?
Because we are using our bodies a lot more. So you've got kids entering into sports at an earlier age. You've got longer sports seasons. Unfortunately, sometimes we have a little bit of excessive weight that we're carrying around, and it's a genetic thing as well, because there's a lot of unknown causes for some of the arthritis out there.
Right. You know, and as we get older in our 30s, 40s, and some folks into their 50s, I'm not there quite yet, but we do have our aches and pains. How do you know if it's just an ache or a pain, or it's a touch of arthritis that you're suffering from?
Typically, you're going to find localized pain, swelling, inflammation into a joint. If we're talking about osteoarthritis, which is the wear and tear arthritis, that's going to be more in a weight-bearing joint like a hip or a knee.
Okay.
And you're going to find increased skin temperature, this big inflammatory component, and lots of pain.
Now, I was reading it. You were diagnosed early with some arthritis, and you were telling me 3 different areas.
Yes.
What kind do you have, and what do you do, and what can other folks do to manage the pain from arthritis?
I have the normal wear and tear. I'm a little bit older, so that would be a little bit more normal. So management includes light, appropriate exercises.
Okay.
That includes flexibility, strengthening, stability, endurance. Therapies like physical therapy, massage therapy, acupuncture, and then other adjunct modalities like kinesiology tape or ultrasound, and then medications which help with the inflammatory component.
I've had people swear by the acupuncture. They say it's great, and I was told to have a little touch of it in the back of my neck, and I said I'm not really big on the needles, but they kind of peer pressured me into doing it. I never got to do it, but is acupuncture really one of the better ways to go?
It is non-invasive in the sense that you're not going deep into the joint. There's different types. There's Eastern and there's Western, so it does help very much so with the pain.
And real quick before we go, you don't have to be even in your 30s these days, right? Now, kids can actually get arthritis?
Absolutely. They are getting younger and younger, and actually arthritis, there's more than 100 different diagnoses, and juvenile arthritis is one of the big ones. So that's anyone under 16 years of age. That's an umbrella term for the autoimmune, inflammatory diseases and rheumatic diseases that they can get afflicted by.
Karena Wu, thank you very much for joining us.
Thank you.
All right, time now, 6:59. PIX11 News at